Hi, I'm Dr. Tom Lewis, founder of RealHealth Innovations. I'm a medical scientist with credentials from the Harvard School of Public Health and a degree from MIT. RealHealth is a health creation company. We focus on prevention, slowing, stopping, and reversing the most severe diseases of our society, chronic diseases. Today I'd like to explain to you what the patient or RealHealth participant experience looks like. So at a high level, what we do is very simple. We perform a risk evaluation of an individual using a tool that we call the Living Profile. It's an online tool where we measure your risk from both your lifestyle, environment, and other extraneous forces. The next, we run biometrics, our chronic disease temperature. It's a Harvard and MIT designed set of biometrics, labs, both blood labs, and we actually do eye testing that helps us understand where you are in terms of where your health is. We can health stratify you. And the last thing we might do is advanced diagnostics. For example, if you have a lot of risks and a poor chronic disease temperature, in other words, poor blood labs, especially with regard to predicting chronic disease, then we might go deeper and understand what the underlying condition is that leads to that. So this is our process, and I don't want to go into this in great detail because it looks complex, but basically all we do is we take a bunch of inputs from you about your health and we create outputs, actions to eliminate the risks in your life and improve your health. So the first thing you do, it's very simple. You take the Living Profile. It's an online tool. You can do it on your smartphone or in front of a computer or a tablet where you get your risk grade and you start reducing your risk by completing actions. So we give you a dashboard as part of our tool. So here we see the Living Profile risk score. This person got a D, not very good. That's actually a good sign. If they don't feel well, we've identified a lot of risks. They have room to work on. In this case, this person has 13 action items assigned to correct their risks. So this is what the action plan will look like. Here's some of those 13. They're eating a little too much fast food. They say they eat the fast food because of budgetary things. Here's healthy food on a budget. Here's something more advanced, understanding how your immune system works so you know about good choices and things that are affecting your health. The next thing we have is you meet a health coach. Now some folks can just go through our so-called self-service program, take the Living Profile, and carry out actions on their own, but some actions are a little more medically involved. So we assign those to a coach or a doctor. So you meet your health creation coach, establish a schedule. The coach will teach you on the RHI, the Real Health systems. You can carry on your own, but your coach will help you complete some of the more complex actions. So we see this person had 13 actions assigned to them they could do on their own, but 10 are held back that really need the direction of their coach. So for example, tooth loss, there may be more complex actions associated with correcting the risks associated with that. And SED rate, your coach can explain to you what this blood lab really means and how impactful it is to your health and how you can correct it if it's a bad number. So next slide is your blood doesn't lie. If your blood labs indicate you're sick, you're sick. You may not have symptoms yet, but it's imminent. That's what chronic disease is all about. It catches up to us slowly. And our chronic disease temperature, we take many, many blood labs and publish a single number. So it's easy for you to understand where you are on the health disease spectrum with regard to chronic disease. It's also a really good number for you to know because if it goes down, your health is improving. So we can measure you and you can measure us. Are we lowering this number? Are our programs effective? So it's a baseline for health. Actions can be derived from your blood labs as well, and it helps us get at root cause. Your eye is a window to your health. Please appreciate that an eye disease is not just a disease of the eye. Our body is intimately connected. If your eye is sick, it's a sick eye and a sick body. Just think about it. Blood vessels are in our eye. Nervous tissues in our eye. A single blood cell will pass through our heart every 60 seconds rather. It'll go through our brain, it'll go through our toes, it'll go through our pancreas, it goes through our eye. We're intimately connected. And we understand that eye conditions like macular disease and glaucoma are actually systemic conditions that are showing up in the eye, and we use that as a barometer for where you are on the chronic disease spectrum, and that contributes to your overall chronic disease temperature. The next thing is you may, depending on how ill you are or how well you're doing in our program, may need the help from a RealHealth health creation doctor. So your doctor will do a chart review, have a consultation, either in person or via telemedicine. The doctor may override some of the actions that the system spits out and say, okay, we're going to make these modifications to your plan, and your doctor may order advanced testing. So that's all measured in our consultation history part. So our goal is, okay, this person started with a D. Now they've gone through the program for a while. They've done some self-educating through the actions. They work with a coach. They may have worked with a doctor. They go back and take the living profile again, and they've gone from a D to a B. What does it really mean? Is they've eliminated risks that were leading to deterioration of their health, particularly in chronic disease. Now that's somewhat subjective. Yes, you've eliminated risks, but your blood doesn't lie. So we'll also take your chronic disease temperature again. It was 103.1 before, now it's 99.5. Your chronic disease biomarkers are coming down. You're getting healthier. Your vital scores have gone up. Other markers have gone up. So really, the Real Health Creation program is as easy as 1, 2, 3. Identify risks, online tool, simple, you can do it at home. Take actions on risks. Once again, you can do those at home, follow the actions, or work with a coach or work with a doctor, depending on the severity of your condition. And measure your progress with our biometrics. My name is Dr. Tom Lewis. This is the patient experience or participant experience in the Real Health program. Thank you for your time.